HealthCare Consumerism Radio. I'd like to introduce our next guest. He is actually an industry veteran in the healthcare and financial services industry, and he comes to us by way of ConnectYourCare. Allen Pease, welcome to the show.
Hey, thank you very much for having me. I'm excited to have the opportunity to speak with you.
Yeah, great. Where are you coming to us from today?
I'm actually in the lovely state of Virginia, so not far from. I live in North Carolina, but not home.
Well, great to have you. Now, tell us a little bit about ConnectYourCare and what you guys do.
So, a lot of people know about ConnectYourCare or something about ConnectYourCare, but certainly not enough. And ConnectYourCare was created by our two co-founders who are still with the company, back in 2002, specifically to administer, build a platform to administer the complexity of healthcare accounts. And when I say that, any tax-advantaged account, the platform that we built and owned can deal with those accounts from beginning to end. So from enrollment all the way through claim substantiation and then reimbursements.
Now, with you guys actually have multiple channels you can work through. So you have, at the end of the day, multiple customers, whether it be a health plan, whether it be an employer, broker, advisor, consultant, right?
That's right. So ConnectYourCare's model is a little unique, although others are starting to, I think, take and use parts of it, in that we sell direct to employers, but we also enable partners such as health plans, financial services firms, whether it's banks or someone else in that industry, and quite a few brokers and TPAs even. And so we have a full product offering from BPO all the way to software as a service, and many clients in the spectrum, throughout that spectrum.
Great. Jamie, this is Ron Bachman. I've followed ConnectYourCare all the way back from when it really started. I know, and I don't know well, but I know of Jamie Spriggs, who's been one of the real founders and drivers of HealthCare Consumerism in here. And I love the original foundation from Revolution Health. Steve Case, one of the internet pioneers, really wanted to change the healthcare industry and was very supportive, if not, I don't know if he was part of the owner, just made a big grant to the original founding. So you all have some very strong roots in consumerism. Tell us a little bit about where you are today and why you are so unique in what you're doing.
Yeah, so we've had an interesting run in that we, like a lot of other companies in this industry, we started off with, again, a couple of guys with a great idea when they saw the legislation that legitimized HRAs, health reimbursement arrangements. That was the impetus for them starting the company. They went out and raised some private equity money and, funded the company. And then we were purchased by Steve Case from AOL fame, and he wanted to create Revolution Health, and as you said, really try and change the healthcare industry. Unfortunately, I think he found, after a lot of his own money, found out that the healthcare industry is a big behemoth that's not going to be easily moved.
Right.
And so we were sold to Express Scripts, which was a great opportunity for the company. Express Scripts being one of the largest pharmacy benefit managers in the company, based out of St. Louis, over 800 million consumers. 100 million consumers. They really helped ConnectYourCare grow and take us to the next level. They did a merger with Medco here last year and spun us off to we're now owned by a private equity firm called ABS Capital. But we're very well positioned to take advantage or help in the transition to as part of healthcare reform. And we see that there will be some sort of an account. It may be an account that we don't know the name of it yet, but we see as the exchanges start operating that there will be a need for some account-based solution, and we're very happy to be able to support both our distribution partners, the health plans, banks that I mentioned, as well as some exchange partners that we have.
Now, Alan, I know the employers right now, too, I think, in our conversations, a lot of employers are trying to figure out who's on first and what should they do, and they're working with their brokers, their consultants. But, in today's environment, what are your one or two things that you see employers really locking in on, and what are their specific needs as it relates to your solutions?
Yeah, that's a great question, and I think it really plays to one of the ConnectYourCare strengths is, we have a pledge. We really look at the industry differently and operate under what we call our stewardship model, and it's all about trying to make it more simple, make it easy for the consumer and therefore the employer, and then motivate people to act using behavioral economics, for example. But what we're seeing is exactly what you said. The employers are kind of overwhelmed by the whole prospect of healthcare reform. What's it going to mean? How's it going to impact their business? So I think the biggest thing that they're looking for is that simplicity that we bring to an employer or deliver through our partners. And what I mean by that simplicity is we have this entire solution set that we can bring in that includes communication materials, how and why to use the benefit, very easy access to funds, whether it's through a multi-account payment card or on the web or through our industry-leading mobile application, and then make this benefit sort of the benefit that the employer doesn't have to worry about. Because, let's face it, again, they've got so many other things on their plate, and the health plan, the insurance component of the whole benefits package is really the big most expensive component. And so it's funny, a few years back we inherited the name by local brokers in the Mid-Atlantic region as the no-noise solution, and they liked us because they knew that if they put us into an employer, that the employer wouldn't have, or the broker wouldn't be getting calls from the employer about the administration of their flexible spending account or health savings account. And so I think that from our perspective, that's the big thing employers are looking for today.
What size employers are in your sweet spot? What's the target? Is there a minimum? Is there a range? Who's your best potential client?
We actually have a little trouble hearing you, but I think the question was about employers, sort of our best customer.
Yes.
We actually have employers from across the entire spectrum in all industries, from individuals all the way up to very, very large multinational companies that have divisions and people in multiple locations. I mean, we just brought on a really big, substantial client this year that did a full replacement. So they, decided it was time. They wanted to move to a high-deductible health plan as the only option for their employees. They did that, and with working with them in their health plan, we actually saw tremendous participation in the health savings account, and well over 50,000 health savings accounts, wow, and over, well over $100 million in assets.
Now, there's a lot of, with these private exchanges and the public exchanges emerging in the market, we kind of almost look at them as a game changer. There's a lot of things changing in this market right now, and to my comment with the employers trying to figure out who's on first, where do you see the market and how it's changing? Is there going to be a different landscape 6 months from now, a year from now? What's your opinion on that?
I really think that that's still to be determined, but I think it's a very good prediction of what will happen, and we're seeing some of it, but I think it's way too early to say who the eventual winners, if you will, winners will be. We're seeing a lot of interest in the private exchanges, obviously the public exchanges. We're participating with some major industry players in that space, and so I think that the landscape will be very different in the next year and a half, and the companies that are nimble and can meet the needs of that evolving marketplace will be the companies that are on top.
I think I saw on your website where you have a relationship with Bloom Health, which is seems to be a big player. I think the Blues of Georgia have been involved. I don't know if WellPoint, who owns the Blues of Georgia, is doing it using Bloom in other parts of the country. But is that a relationship that you all are developing and you're going to be providing your services to? Absolutely, and we were selected by Bloom a couple of right
right after their inception. So we were very early into the space, and Bloom, as you probably know, was one of the first exchanges.
Right.
And so it's been great for us because we've been able to gain a level of experience, and the Bloom guys are great folks. And so, working together, we've been able to learn some things, and I think that we'll be able to translate that knowledge into other partners as they emerge in the market.
There's been a lot of discussion in some of the HHS regulations that have come out in the last few weeks around defined contribution programs and use of health reimbursement arrangements, one of your services that kicked off your whole organization way back when, 2002. How do you see defined contribution developing in this marketplace through private exchanges or otherwise?
We think it's essential, and it will have to be a part of any solution, particularly with the exchanges and the way the model appears to be structured. And so one of the things I tell people is don't necessarily get hung up on the acronym of the day. In 18 months, it could be called something entirely different. Mm-hmm. And the good news is, we're there because we built and own our own platform, very, very flexible and configurable, that whatever they call the account, and, I love the government, but whatever they end up naming the account or the acronym, we'll be able to meet the needs and be able to administer that for our partners and for their clients.
In terms of the new services, I think I also read something about a new mobile app that you all have available. Can you tell us about that at all as we sort of wrap up this section?
Sure. We're very, very excited about our mobile app. As anybody knows that you travel around, or unfortunately you drive down the street, you see that somebody's got a mobile phone stuck to their ear. I forgot the last number, and it's growing every day, the number of consumers that are using mobile devices. And I've got kids that, my 13-year-old won't talk to me, but will text me all day long. So it certainly is the wave of the future. We created our mobile app to really mirror all the functionality that we have on our website and our portal. And so, if I may, one of the neatest things that I think we have is we have a partnership with First Data for our debit card, credit card processing, and people who sign up and use our mobile app, you literally can be in a pharmacy, you can be in a point of service location, and if you swipe your debit card, we can send you a text message, typically within seconds, and notifying you that you may need to have a receipt for that particular transaction. And we have the ability to take a picture with your mobile phone of that receipt and instantly upload it to the system, and then we would use that receipt for adjudication purposes. So really eliminating one of the big hassle factors with these accounts, which, as everyone that's used one or anybody that's in the industry knows, that submitting those receipts can really be a pain in the neck, and we tried to solve that conundrum and make it as easy as possible.
Well, Allen, thank you so much for joining us on the program today. We really appreciate it. Look forward to seeing you at IHC Forum East. To our audience, stay tuned for the next segment of HealthCare Consumerism Radio.
This is Ron Bachman, Chairman of the Editorial Advisory Board for the Institute for HealthCare Consumerism. The IHC is a collaborative community for innovative health and benefit management solutions. If you're a